And today I'm going to be talking about the gap analysis of the healthcare leadership issues. We all know the Canadian healthcare system is currently facing enormous problems. Among them is the aging population, the cost, and the waiting time. My focus today is going to be the waiting time as one of the big challenges that the Canadian healthcare is really facing. Waiting time can cause serious repercussion on patient health. It can bring about greater pain, suffering, and mental health agony. It can also have negative impact on medical results and sometimes leading to death. These factors have greater impact on patient health because depriving a patient from having easy access to medical care would either result into emergency needs or making some people just carry out some self-medication, and sometimes it goes weird on them and then it results into death. The present state of Canadian healthcare sector is really on the high side. The physicians are between 2021 and now record the present median wait time as 25.6 weeks. The Kaiser family conducted a survey between 1993 and now. It was recorded that the median waiting time in 1993 was only about 9.3 weeks. However, in 2020, it increased to 22.6 weeks with the COVID-19 as an influence. But between 2020 and present, the waiting time has drastically increased between 22.6 weeks to 25.6 weeks. The future preferred state of the waiting time in healthcare sector in Canada would really, according to the Organization of Canadian Medical College, would be lessened if there is inclusion of nurses practitioners and other healthcare practitioners. It is recorded by them that there's going to be an increase of 9% between 2023 and 2030, which would result as a 45% increase of health practitioners, and LDRS would really reduce the waiting time. It would also be an added advantage to make the healthcare sector have enough recruiting effort and focusing on the long-term workforce planning. To close this existing gap, the existing gap between 1993 and 2020, it's actually due to the lack of commitment from the few employees and then the lack of health practitioners. However, to better address these needs and expectations from the healthcare sector, the government needs to implement some models that will bring these services together and would provide opportunities for seamless care delivery. These models include fostering collaborations and communication between various doctors and healthcare providers through the use of integrated care. So making sure departments have enough employees on hand, and which would help them avoid overwork, medical mistakes, and fatigue. Because if a department in a hospital settings have just 2 staffs, I mean, we are humans, everyone will probably get tired. But if there is going to be enough hands, there is going to be enough nurses on ground, enough practitioners on hand. Even if one person is tired, there can be implementation of another person to cover up for the tired person, which would actually make the whole process of attending to patients really fast. Another model includes investing in digital health record, which will facilitate care coordination, and also expanding industry-leading telehealth capabilities. If this gap is closed by implementing these models, the Canadian healthcare sector would actually enjoy a relieving system. Not alone will the practitioners enjoy it, but the patient also will have easy access to the Canadian to the Medicare. The solutions that is necessary or that is needed to be provided in this situation to foster closing the existing gap would be by creating accessible schedule for patients according to the study from the Cumulative Index of Nursing and Allied Health and Medline OBID. After going through the database between 1980 to 2023, they can only say that, okay, the solution that is needed to allow a good healthcare sector in Canada is by creating accessible schedule for patients, making availability of explicit calls for follow-up consultation, engaging nurses and general practitioners, and then the presence of capable and enough practitioners on duty. Long waiting time have plagued Canadian healthcare system, even when compared to other countries like the United States or the United Kingdom. However, if there can be implementations of delivery models, such as integration of clinical network, accountable care organization, extended family practice, and lots more, if it can be focused on eradicating the waiting time and reducing the patients, the queue in the hospital. Another study carried out by the Canadian Foundation for Healthcare Improvement reported that the access to family doctors in Canada is really getting more challenges, thus causing rising prevalence of chronic illness and disability. They carried out a study in 2018, and it was recorded that, okay, the increase in the unwell adult in Canada reported 23% due to the waiting time, compared to what they have in Switzerland, which is just of 2%, and New Zealand, which is just of 5%. The literature review extensively evaluated and summarized strategies that can be implemented at reducing waiting time in Canadian healthcare sector. They come to conclusion that the most often used strategy in other countries can also be implemented in the Canadian sector, which would actually shorten the waiting time in the healthcare sector. According to this research, the best solution to implement in this situation is by giving open access scheduling, which would actually considerably lower the waiting time. Another study was reviewed or carried out by the College of Family Physicians of Canada in 2020. And also, this study come about a solution which they think would only provide a solution to this waiting time in healthcare, in Canadian healthcare. He says the only strategy to also implement in reducing the waiting time is by increasing the number of family doctors and putting in place incentives to encourage doctors to accept more patients with complicated needs especially, and also encourage family doctors to run evening and weekend clinics. That the clinic should not only be run on weekdays, however, should be run on weekends. This study also recommends open access scheduling, just like the previous one. They also recommend the open access scheduling as the optimal strategy to meet the required waiting time. The future recommendation to allow closing these existing gaps in the waiting time of healthcare sector is by examining correlations between the open access and other waiting time. The future research should focus on evaluating the overall impact of measures to shorten waiting time for healthcare appointment. There should be a cost-benefit analysis of implementing interventions. And also, another study is issued for the healthcare sector to concentrate on evaluating how this intervention can affect the quality of care and continuity of care, and also consumption of additional healthcare service. Another focus should be on doing virtual consults, not in person. I mean, the technology is really growing, and then everyone can have access to the computer, to their phones, and then they can always set up consultations. Back from where I came from, people sometimes don't need to go to the hospital to receive treatment. There are different applications where you can just go on and then schedule online appointment with doctors that you don't even have to see them in person. You just make your payment, and then you get your diagnosis and everything. Another future recommendation is that the patient should be informed about incorporating e-referrals on doctor's directory before sending a recommendation. By sending e-referrals would enable the doctors to select next available appointment or choose a specific provider after examining the wait time. Another recommendation is pre-assessment strategy may be tried in the specialist clinic by including evaluation phase between the referrals and the specialist. The government should also collaborate with the leaders in the healthcare industry in order to better inform patients, families, carriers, and carers and providers about the variety of health services available at every age and stages of life. The government should also collaborate with the medical experts to guarantee that all patients, especially those with complicated requirements, have easy access to wide variety of health services in the community. If all of this can be put in place in the Canadian healthcare sector, everyone is going to have easy access, easy scheduling, and there would be no waiting time where people would have to just deal with their health and then just manage whatever they're going through, and sometimes making families lose their loved ones and all. And below are my references.